At the 13th Annual Congress of Obstetricians and Gynecologists, Lumeden Medical showcased two different technologies. The first one is the Lumescope medical imager, and the second type is the FULLTERM technology, which is still being developed and can be presented to the medical society next year. I will give you more detailed information about the Lumescope medical imager, which is ready to appear on the market and which you can see right now in the studio. What about Lumeden medical imager? The Lumescope technology provides an important tool for first users to examine patients with a handheld, wireless, high-resolution battery-operated imager that fits into a lab coat pocket. So it's easy to use for the gynecologist, and I will explain why. Let's imagine a traditional gynecological examination. A patient comes in for an examination, undresses and puts herself up on the examination chair. The doctor wears examination gloves, places an external illumination source so that he can see the cervix with his eyes with the help of a speculum. The current procedure possesses a risk of infection for the doctor and may be unpleasant for the doctor if the patient has a vaginal infection or does not have proper hygiene. And many of these doctors examine 20 to 30 patients per day. With the Lumeden technology, we eliminate these problems. The doctor positions a speculum in a patient's vagina as per a standard gynecological cervical visualization. He or she then positions the Lumescope at the open aperture of the speculum. You will know that the Lumescope imager is always outside of the patient and, of course, never comes into contact with the patient's tissues. Next, the doctor adjusts the magnification wheel for a magnification up to 15 or 20x, while simultaneously viewing a real-time image of the cervix on his computer screen. Once the cervix is properly focused and magnified, the doctor simply presses the image capture button on the Lumescope. The image is then saved on the Lumescope software. The doctor determines the magnification by looking at the magnification wheel setting. Regions of interest can then be measured using the software, and the distances and the areas measured are then recorded automatically by the software and can be saved as a second image. The doctor can then print a high-resolution cervical image to give the patient and also keep in the patient's medical records. There are many thousands of obstetricians and gynecologists worldwide. The Lumescope is very easy to use, so it can also be used by midwives and nurses, which makes the market extremely attractive. Plus, the first users during our clinical trial have stated that patient examination time is reduced from 50 to 70%. By the way, both of patient and doctor can have a printout of the cervical image at the time of examination. Here you can see the printouts with the images made by Lumescope. Taking pictures is particularly useful where treatment is provided to the patient so that a pre-treatment and post-treatment can be compared. The patient and the doctor can see that the treatment was successful. The benefits for medical professionals are such: doctors, midwives, nurses, and other healthcare providers are interested in rapid, low-cost, quantitative diagnosis and quality of patient care. Lumescope permits the medical professional to image a patient's cervix anytime, anywhere, with a wireless, handheld, pocket-sized and carry device. Lumescope technology eliminates the need for glove digital cervical OS measurement, which is not accurate and can vary from one medical person to another according to the size of their fingers. Lumescope technology allows the medical professionals to take bedside cervical images and monitor cervical changes without having to schedule a specialized colposcopic examination. It permits medical professionals to image, measure, and archive sexually transmitted disease lesions and abnormalities manifesting on the cervix. For example, HPV, chlamydia, gonorrhea, herpes, candida, etc. It permits medical professionals to image, measure, and archive precancerous and cancerous cervical lesions and share patient images conveniently while monitoring changes conveniently over time without a standard colposcope. It provides an easy, cost-efficient methods for sharing patient records with remote specialists. Talking about the patients are interested in convenience, comfort, and peace of mind provided by diagnostic imaging. Lumescope technology provides elimination of uncomfortable glove digital examination of the cervix and cervical OS dilation for patients, peace of mind and reduced stress, increased access to specialist care, especially in rural areas where access to specialist and advanced diagnostic equipment is not available. So the Lumescope imaging system is used by medical professionals, including obstetricians, midwives, gynecologists, nurses, and general practitioners to accurately image and measure features and pathologies of the female cervix.